Hello everyone. Uh, I am UPASONA Dash, Ms.c Nursing Tutor from Sri College of Nursing. And today I will be talking about evolution of mental health services, treatments and nursing services. So today we will be learning about how mental health services evolved globally and in India. What were the major developments that took place in psychiatric treatments and therapies? How the mental health nursing role is changing with time, and what are the mental health policies and legislations in India, and what is the future trend for mental health care and nursing practice? So first, think that from a time when mental illness was seen as a curse, and what people used to do was put these patients in chains and exorcism, to where we are now. We are now recognizing that providing proper care to the mental health patient is a fundamental right of the patient. So we are seeing that throughout the history, there is a change in narrative of how mental illness is being understood, what are the treatments and care that we are giving for mental illnesses. And as we will move through the session, we will be seeing what are the specific milestones that shaped the mental health treatment or the mental health care that we are providing to our patient. So right now we have known that the journey has been very long. Earlier it was very painful, the mental health treatment was very painful, and now we are trying to give care with as much compassion, and we are recognizing the patient's dignity. So first we will be seeing how the mental health services evolved globally. So in the ancient era, the mental illness, like we know that it was attributed to supernatural causes. So people were chained, they were exercised. Then came Hippocrates, who explained through a medical model, that is the humoral medical model, and suggesting that the cause of this mental illnesses were not some supernatural beings or supernatural entities, but rather they were biological causes. And from there, we moved from a mystical cause to a more biological cause. Then come the Middle Ages, where we saw the emergence of the asylums. So basically, there was Bethlehem, which was very famous, and these asylums, they mainly prioritized confinement of the patient. So therapeutic care was not there, and confinement was more prioritized than providing proper therapeutic care. So people were largely institutionalized, and they were confined but not given proper care. Then there was a significant shift during the reform era, that is the 1790s. There came psychiatrists like Pinnell, who believed in moral treatment and was very famous for removing chains from the patient. Then there was Dorothea Dix, who was mainly advocating for more human treatment of the psychiatric patients. And their work is now the groundwork for modern psychiatric practices. Then we come to the 20th century. So here, most famously, we know Freud, who introduced us with the mind's complexities. He brought the psychoanalytical model. Then there were medical interventions like the electroconvulsive therapy, and also antipsychotic drugs. Chlorpromazine came into being, which was like revolutionized the treatment for schizophrenia. So this developments provided like new tools for managing the severe mental illnesses. Then came the deinstitutionalization. So during the 1960s to 1980s, so there was a shift of care from institution to more community-based services. So there was basically the transition we were seeing, like there was underfunding, new challenges for their pay, like there were no like human resource were not there who would provide the patient with this care in the community. So there were a lot of changes, but the idea was right, and we now have come to the modern era, which embraces the recovery model, and we focus more on empowering the individuals to lead a more fulfilling lives. Then comes the our bio psychosocial model, which emphasizes that mental illnesses are not because of only any single uh, cause. There is a mixture of cause, like there is biological cause, psychological cause, social causes together which affect the patient's mental health. And for treating a mental illness, we have to focus on all these aspects. So then there is the UNCRPD initiative, like the WHO action plan, which guides to promote mental health as the fundamental human right globally. Now, coming from the treatments, we will be seeing what were the mental health treatments that were available. So we are now turning to the evolution of mental treatments. So from superstitious practices, we have moved into like more sophisticated and healing evidence-based interventions. So in the pre-scientific era, there was like there were many things like drilling holes into skulls, ineffective, uh, which were mainly very ineffective, and exorcism, then herbal medicines. So it is important that like we cannot say that all of this was ineffective. Some of the traditions, like those in within the Ayurveda, they offered genuine therapeutic value. Then we are coming into the 20th century, which focused more on the physical treatments like the electroconvulsive therapy, and till now we are using this therapy. Then, however, there were methods like insulin coma therapy, which was later abandoned. Then lobotomy, like we don't practice it anymore because it has devastating side effects. Then the shift occurred within the farm in the 1950s to 1990s. There was a shift, and we started using more medications. So there was like a pharmacological revolution in the field of psychiatry, like with the introduction of chlorpromazine. So we started using chlorpromazine for effective treatment of psychosis, and then we started using Prozac, and now we are using atypical antipsychotics. Parallel to this, there were other things that were developing to treat mental illnesses. There was development of cognitive behavioral therapy, which was pioneered by Aaron Beck in 1960s and 70s, and till date it is like one of most prominent psychotherapy that we are using, and has lot of like evidence based approaches. Now there are also we are now in the like in the new era of psychotherapies, which include dialectical behavioral therapy, acceptance and commitment therapy, and eye movement desensitization and reprocessing therapy. So there are some emerging fields that we can see in the field of mental health treatments, like the ketamine therapy. transcranial magnetic simulation, psilocybin assisted therapy, which are continuously going under clinical trials so that we get a more evidenced evidence and we can bring it to our daily practices. Now, evolution of mental health nursing. So first was the custodial era, which was before the 20th century. So here, individuals who were called attendants. So basically, their role was to focus on restraint and control. So there would be a like custodian who would manage these patients by restraining and controlling them. There was no therapeutic intervention. Then this custodians, they generally lacked any kind of formal training, and uh, then our focus shifted, and with in 1960s, with Florence Nightingale, she like introduced the environmental theory, which emphasized a very clean and calm and orderly environment for to promote healing, laying the groundwork for development of the psychiatric therapy, psychiatric nursing. Then came Hildegard Peplow, who is referred to as the mother of psychiatry, and she basically focused on the nurse patient relationship or the therapeutic relationship and outlined four phases, that is orientation, identification, exploitation, and resolution. So that a more structured therapeutic intervention could be given to the patient. And currently, we are now embracing the role of community, and there are psychiatric nurses who are serving as community psychiatric nurses and are involved in case managing, delivering psychoeducation in informed, in giving trauma informed care, and they are actively participating in patient advocacy. So here we can see that we have moved to a more holistic approach towards mental health care delivery.